Hi, folks. This is Abnormal Psychology, and today we're talking about body dysmorphic disorder. Used to be called dysmorphophobia. And so, who are the folks who end up with this disorder? Well, folks who have an unusual focus and concern about their physical appearance. Okay, and what they seem to focus on are fairly minor flaws, perhaps even those that are uh, unnoticed by others, like a tiny birthmark here. Knew someone in the 80s who had a female who had a focus on a tiny little red spot above one of her eyebrows. Um, so these may be unobservable to other people. They take on an importance that is far beyond what we would normally consider as a physical concern, as a flaw. Say someone who has missing arms and legs, or some other kind of obvious physical flaw, if you call it flaw. I don't even like that word. So at some point, the person begins to focus on this and perform repetitive behaviors, which is in some ways like OCD, to reduce their anxiety. They may, for example, look at mirrors constantly, or groom constantly, or put makeup on things they think people can see constantly. They may also avoid, as part of their ritual, if you'll call it that, looking in the mirror or checking, you see. Now, this it causes distress and impairment. It can become so overwhelming that they get things like uh, cosmetic procedures. They may have cosmetic surgery, or they may have chemical peels, or what, depending on where this thing is that's visible. Usually it's the face. That's usually what they see some flaw in that others, they are sure, by assumption, must be terrified by or find gross or disgusting. Now, you can have one kind that is involved in muscle dysmorphia, where a person, more male than female, uh, believing that their musculature is too small. They're without muscle, so therefore they must be noticed by others as being unappealing. And some people who go to gyms will fit this category. You may notice that many males are looking in the mirror when they work out with mates. You can see it repeatedly looking in the mirror as they go through range of motion with weights. Now, sometimes that is subclinical, right? They're just checking to see if they've gained any muscle that they can determine has increased. Or it may be someone who's narcissistic, someone who's already big and they like looking at themselves. Or it could be this. It could be this disorder. You know? Now, some people have good or fair insight. They recognize that their beliefs are not true, or or if it's fair, they're not sure if it's true or not. But they can have absent or even delusional beliefs, absent insight or delusional beliefs about this. They don't even recognize that their concerns are irrational, or they completely are convinced that their beliefs are true. Hmm. Okay, so um, so a fair percentage of people go to either cosmetic estheticians, or they go for uh, uh, um, surgery by cosmetic surgeons, as I said. And, I guess there are enough disreputable plastic surgeons who would do additional surgery, even if it's all on the face. But a reputable plastic surgeon, which is the vast, overwhelming majority of them, won't do that if they talk with the patient and can discern that they have uh, this problem, because the surgery won't fix it. Okay, it will not fix it. So this is heavily culturally influenced, but it's not culture bound. It's not just in the United States, for example. It is culturally influenced in places where cultural beauty is ramped up to a very high level of requirement. You'll find more examples of this disorder. Um, what else? Well, the prevalence is around 2.5% in the United States among adults. Slightly more females than males, but among the subtype of muscle, uh, lacking muscle or perceiving a lack of muscle. Of course, it's more among males. Up to 15% of dermatology patients, up to 8% of cosmetic surgery patients, up to 8% of orthodontia, is that right? Patients who want to have their teeth fixed because they believe that their teeth are somehow imperfect to the extent that others notice it and are repelled by that. Onset's usually in the 20s, early 20s, and it often runs a lifelong course, a chronic lifelong course. It's so sad to me. The risks, well, childhood abuse and neglect, and there is an elevated incidence among first-degree relatives with this disorder. Yeah. So, have you ever seen those shows like The Swan? These are shows from the 90s, really. They've all but disappeared. The Swan, Extreme Makeover, I Want to Be a Famous Face, Dr. 90210. All of those are heavily populated, I suspect, by people with this disorder. What does this come with? What are the comorbid conditions? Well, depression, with high rates of suicidality. Underappreciated that the suicide rate is higher by a darn sight in this disorder. I don't think we have good numbers on that, but it's definitely true that it's higher. Social anxiety disorder, again, OCD, yes. Substance abuse, yes. Narcissistic personality disorder, yes. Mm-hmm. How do we treat this? Well, it parallels that for obsessive compulsive disorder and also hoarding. SSRIs may give relief for depression and anxiety. Maybe. It may decrease the obsessional component. Get that thing out of the way there. Okay, there we go. And exposure and response prevention. So we want cognitive behavior therapy, yeah. Okay, well that's this disorder, body dysmorphic disorder. Take care.